I am Rachelle Simon, Executive Director of the United Way of Pettis County. We are a small United Way. I'm the only employee of the United Way of Pettis County, so we run on volunteers, and our work is to unite people and resources to improve the community. Yes, so it's actually three ways that I'm able to use Unite Us. The first is because I'm a small United Way, we have our own programs. I case manage for a couple of them, and so it helps me to essentially run the programs. It's referral based, so other social services refer to my program, and I'm able to receive referrals, help meet needs in the community, and close that loop. So I use it that way. The second way is I am part of the Torch hub, if you will, and so transformation of rural community health. It's how Medicaid dollars filter through the state of Missouri, and one of those things is for B3 services. So I work in environmental modification. So essentially, folks who are sick, you ask why might they be sick? Maybe it's because they don't have heat in the winter. Maybe it's because there's mold in their house. And so what we're able to do is I run that program. So people send referrals to me, and then I work with contractors. I send, an electrician in to fix dangerous electricity, or, a mold removal company to do those kinds of things. So that's the second way, is I send and receive referrals that. And the third way is really great. We opened a walk-in hub. So there's 8 organizations that work together in Pettis County to serve folks. And so it's essentially allows us to have Mercy Services United is its own organization under Unite Us. And so I can receive clients and do assessments in Mercy Services United, but also toggle back and forth between my own organization to do programs. So those are a few of the ways. Some of the ways we're allowed to innovate is this hub model. Really, I wasn't sure how it was going to work without Unite Us. And what I mean by that is, you have 8 organizations that have our own programs, but are also trying to work out of a hub where someone comes in and we want to do a full needs assessment. But where are our clients going to live? Where is that assessment going to live? But Unite Us creates, we have our own organization under Unite Us. So we can all come in and we can work on assessments together, and we have different shifts. And so I'm working a walk-in, and Sally comes in and has a needs assessment. We were able to create a custom form, which was wonderful in Unite Us. We sat down with all of our partner organizations and says, what do we want to be on this form? And so we were able to do that. It also is able to give us data, which is really helpful to advocate, to say, okay, of all the assessments we did, housing and transportation, 60% of the folks we assessed need help with that. That's incredibly valuable data that all of us in our small organizations don't necessarily have the time to track, but Unite Us does that for us. And so we can go to our decision makers and government leaders and say, here's what we're finding out, and how can you help us with solutions? We work very closely with various health entities in our hub, and I think that's something that a lot of people wouldn't necessarily think about right off the bat when we're thinking about how we're going to support folks in our community and meet needs. We've got the federally qualified health center, Bothell Regional Health Center, which is a hospital and ER space plus clinics, and then we've got Pettis County Health Center. So essentially, the partnerships that surprised me were that what other entities might first see as those are competing in our community, actually by working together, we're better able to meet needs, which I think is a win-win for everyone. I think don't wait to have the sustainability for the next 10 years planned before you start doing whatever it is you're going to do. I think we have to take steps. We have to trust a little bit in the process. And as long as we're honest as we're building those things, that's a great way to know that if you're being successful. So I would say my first piece of advice is don't be afraid to sort of, as everyone's been saying, build the plane as you're flying it. I think that's where ideas come from. You have to start and then you get feedback, and don't be afraid to change. I would also say don't be afraid to ask for what you need. I think a lot of community-based organizations get caught up in asking for dollars instead of actually, here's the issue I'm seeing, here's what I need. And perhaps, what I need is some funding to do it, but perhaps what I need is more staffing. Perhaps what I need are relationships. Perhaps what I need is more people being willing to work with me to get those things done. And so those are a little bit of the things I would offer. What we do matters, right? The people we serve, how we meet those needs, that matters. But I think how we do it matters more. And people, whether it's like humans you're sitting across from and trying to build a partnership, so knowing that you're genuine, knowing that you're listening, knowing that you actually believe in cooperation over competition, you're not just saying that, that matters. Whether you're serving clients, our hub is called Mercy Services United, and I tell people the mercy is how we do the work. And I think that it reads to people, it makes a difference, and it makes people not only trust that you really want to help, but also when hiccups happen, when they maybe something fell through that they thought would work, they're more likely to call you and say, oh my gosh, it didn't work out like you said it would, because they trust that I really do want it to work out. And so I would say the how we do the work matters just as much as the what we do. So our walk-in hub, we get all kinds of folks that walk in for a variety of different reasons. But one success story is, was new to the area, didn't have a job, didn't have anywhere to live, and kind of walking in was assessed, but we were able to get kind of that wraparound multiple organizations invested, and eventually, got a job, got a car, got an apartment, and I haven't heard from in a while, and I think no news is good news, right? Because I think that means that that's a success story, and I think I could tell so many more of those, but that success story was built on other staff members and each other trusting one another to say we actually all do care about where we're getting, but also being willing to say it's going to take a little time. I think often, we build a relationship with someone and it's like, oh, we want to help them right now with everything, and that's not how it works, right? You have to build a relationship, and came back day after day, and it was those small celebrations of being able to, hey, you got a job, or hey, this move, you now have a car, and so those little celebration moments really move people along, and I would say it's the same for staff to celebrate those little things.